Hey everyone, this is Dr. Jeff Williams with Creekstone Integrated Care right here in beautiful Amarillo, Texas, coming to you again this week with a new video called How to Know If You Need to Go to a Chiropractor. I'm going to share a secret with you here that this may get me in trouble with some other chiropractors, but the secret is this. Not everyone needs to go to the chiropractor. It's true. Not only that, but very few people actually need to visit a chiropractor once per week for an extended period of time. Most certainly not the rest of their lives. Now, you may have heard that if a patient has a spine, well, then they need to see a chiropractor. Well, while that's good, it's a good thought, and I understand where it fits in the context. This taken literally is just not a fact when we look at the research on the matter. Not to say that the chiropractors that propagate ideas of seeing them every week, lifelong, or anything like that, not to say that they're intentionally misleading. That couldn't be further from the truth. Not at all. Many believe each and every person should be under constant chiropractic care from birth to death, and that's not their fault. In most cases, they were taught this at seminars and lots of times in chiropractic college, depending on which college they attended, of course. In general, a patient should have a treatment schedule with a beginning and an ending. It should not be long-term throughout the year in most cases. Now, there are some more severe car wreck injuries that could take more than a year to heal up from and to treat. But by and large, most patients need us to help them in the short term and teach them to self-manage their condition on their own at home. And that's what we should be doing for the most part. There's always exceptions to the rules, but in general, that's the way we need to be doing it. So, who needs to see a chiropractor? The first obvious group of patients that need to see a chiropractor is the group of patients that are hurting, those having pain. It goes without saying that if a person is suffering from a non-complicated musculoskeletal issue, well, it makes sense to see a chiropractor. It all comes down to having a chiropractor that can do a competent and very thorough initial examination. Accurate, good, effective treatment starts with a specific and correct diagnosis. Non-complicated pain means without serious complications, such as a fracture or something that may require surgical intervention for correction. Run-of-the-mill musculoskeletal pain is typically treated more effectively by chiropractors that are skilled with implementing exercise and strengthening activities as part of the spinal manipulation and treatment protocols. So let's face it, let's just be honest here, folks. While family practitioners are very talented and very smart folks, they're very good at treating within their wheelhouse. Things like diabetes, obesity, high blood pressure, the big ones, right? But they've not really been trained or been given particularly effective strategies for treating non-complicated musculoskeletal, spinal, or joint pain. They just haven't. Usual medical treatment for such a thing has been anti-inflammatories, pain medication, and or muscle relaxers. More and more, though, research has emerged over the last several years showing the sincere ineffectiveness of these modes of treatment. In addition, we've been unfortunately learning more and more about the harms of many of these. Most spinal or joint pain responds very favorably to manual therapy, manipulation, and to exercise and strengthening activities. And when we are combining all of these strategies, our patients, they're the winners. They win big time. Another great set of patients doing well with chiropractic care are those suffering from disc bulges, disc herniations, degenerated discs, dehydrated discs, arm pain or numbness into an arm, leg pain or numbness into legs, facet pain, stenosis, also headache patients, headache, migraine, tension headaches. All of these conditions are very, very effectively managed conservatively, non-pharmaceutically, by a smart, responsible, and evidence-based chiropractor that knows well when the condition needs to be managed in their clinic or if it needs to be sent out. The duration of the pain really matters, but it doesn't matter with regard to whether you should see a chiropractor. It matters because short-lived pain that's not been around all that long, it takes less time to resolve. Whereas long-term or chronic pain is a whole different beast altogether, and it takes longer to treat and to resolve. Just to be specific, the National Pain Strategy defines chronic pain as having pain at least every other day for 6 months or more. Common sense and, of course, research, because I'm a research nerd, it tells us that chronic pain, it's much harder to treat than acute, short-lived pain, and it just takes longer in general. Both chronic and acute pain patients should be under the care of an evidence-based chiropractor, though. There's no doubt there. So, who does not need to see a chiropractor? There are those that simply don't need a chiropractor. An astute and well-educated chiropractor can usually pick up on some hints on the initial exam as to if a patient is a poor candidate for spinal manipulative therapy. For example, hypermobile people, they're not always good candidates. If I ask a patient to bend over and touch their toes, and they go straight over and put their hands flat on the floor, well, they may be hypermobile as a result of a connective tissue disorder. And at that point, we put our patients through what's called the Baton scale. The Baton scale is on connective tissue disorders, and we try to assess where they lie on the scale. Hypermobile patients already have too much movement in the joints of their entire bodies. That's why putting more movement into the joints is not always the ideal thing to do. Hypermobile people that are stretchy already, they do better with weight training and strengthening activities that are meant to stiffen and firm up their joints. Also, going to a chiropractor all the time, every week, throughout a lifetime or several years at a time, can create hypermobility in a spine that was not hypermobile naturally. So that's another reason we don't recommend going to the chiropractor every single week or lifetime. Now, it's normal to go 3 times a week for a week or two in the beginning, twice a week for a week or two, once a week, a treatment schedule that has a beginning and an ending, that's fine to go that much. But to go extended, long-term, 1 time a week, or something of that nature, well, then you can start creating hypermobility where there wasn't any prior to that. Now, we do not typically treat pregnant mommy-to-bees before the 12-week mark or after the 36-week mark in pregnancy, although you can visit massage and acupuncture up until the day of if you're pregnant. Although we can have a profound effect on their pain during the window we can work with them. So we have had some mommy-to-bees that just absolutely swear by chiropractic in that little 12 to 36 week window, and they say they just wouldn't have made it without us. So, but some pregnant women, depending on where you're at in the cycle, then might not be good candidates for chiropractic. And while we can still use non-aggressive means to treat them, osteoporotic patients are not ideal traditional chiropractic candidates, at least not for the traditional high-velocity, low-amplitude adjustments that chiropractors are most normally associated with. Those having had prior strokes, it is not usually a good idea to have traditional adjustments to the neck region in these patients. Although, again, much like osteoporosis patients, there are techniques that we can still help these patients outside of the manual, hands-on, traditional neck adjustments. We don't have to do that to make a difference and to help. A big one here is cauda equina syndrome. This is a really dangerous condition, and it's an emergency. This is when the patient is having numbness or tingling in any area of the skin or region that would touch a saddle if you were on a horse, and or having difficulty controlling bowel or bladder function. As mentioned, this is an emergency and needs to be at the hospital immediately. They don't need to be in a chiropractic office. Now, while there are other reasons chiropractic may not be right for a person, those are the ones that are coming to mind immediately for me. In short, people need to quit looking to shots and or medication as the cure-all for non-complicated musculoskeletal pain. The opioid epidemic is to blame for 71,000 deaths in 2018 alone. Tylenol and ibuprofen send over 100,000 Americans to the ER every year and are to blame for 16,000 deaths every year. Painkillers, anti-inflammatories, and muscle relaxers are mostly ineffective, according to research, not me, don't take my word for it. And spinal manipulative therapy has been proven through research to be equal to many of them in comparison research papers that compared the two treatments. Spinal surgeries have been shown to have increased dramatically over the years, but the outcomes, how people do as a result of the surgeries, have shown no change, meaning they're somewhat ineffective. In addition, the research behind most spinal surgery is not adequate enough to even consider taking on that sort of huge risk when you look at the percentage that fail or must be repeated. And I'm just being honest here. There are clear reasons to do everything possible to avoid any spinal surgeries. Sometimes you can't avoid them, and that's okay. Thank God for surgeons in those cases. But if you can avoid them at all costs, do it. And then consider this. The American College of Physicians updated their recommendations in 2016, just 3 or 4 years ago, saying that spinal manipulative therapy, exercise, massage, and acupuncture are now recommended by them as first-line therapies to treat back pain. First line before Tylenol, ibuprofen, before any shots, before any surgery. So if you've not done all of those, but your doctor is recommending surgery or shots, they flip the recommendations upside down. And now they're telling you things in reverse order. The correct order, according to the American College of Physicians now, is spinal manipulative therapy, massage, acupuncture, exercise rehab, and there's a few others there on the line. But I think you get my point. The VA system now in America, the VA system is now sending its veterans to chiropractors and acupuncturists, and the federal government is paying for those treatments because the research is so convincing now on the matter. Also, almost every insurance plan covers chiropractic. That tells you something. And every professional and most college sports teams, depending on the size, all Division I teams for sure, have a chiropractor on staff. There's a reason, folks. Now, if you need a chiropractor, now is probably the time to go ahead and call one. A good guide to get you started in finding a good, smart, evidence-based, knowledgeable chiropractor is by going to the website here on your screen. I'm going to list it out here. Go there, go to the map, and see who is in your area. If you're in the Amarillo, Texas area, of course, feel free to give us a call. My number is 806-355-3000, and our website is creekstonecare.com. And we'll be happy to get started working with you pretty much immediately. Now, if you're watching this on YouTube, hit the subscribe button there so that you don't miss any of these valuable videos every week. If you're watching it on Facebook, help us out by sharing this video with your network of friends and family. Together, we can really get the word out and we can change the culture of healthcare and chiropractic for these types of conditions. Again, I'm Dr. Jeff Williams with Creekstone Integrated Care here in Amarillo, Texas. Take care of yourselves. Have a great week.